Well, it's that time to thrive with Twin Cities Live, and that means we're taking care of our skin.
You know, we're just a couple of months, couple of days away from the month of May. I got there. It also happens to be Skin Cancer Awareness Month. And as TCL reporter Kelly Hansen explains, removing skin cancers doesn't always mean surgery. I think that's the fear that you have to like dig out so much, especially if it's on your face. So she is taking us to advanced dermatology care, where they offer a more gentle and a less invasive option. And that means removing those cancers with zero downtime.
Oh, I like it.
In the spring in Minnesota, people are wanting to get outside. Maybe they're not protecting their skin as well. And so you're seeing several patients that come in here with spots, with moles that are essentially skin cancer. Are you seeing quite a bit of this?
We see lots of skin cancer. Skin cancer is the most common cancer people get. Fortunately, the basal cell does not spread, which is the most common skin cancer, but it can keep getting larger, more destructive, painful, uncomfortable, bleeding, and the longer you let it go, the more challenging it can be to get rid of it.
These are things we just don't want to leave on our body.
Correct.
We need to have them removed, and there are a couple of ways to do that. What are those?
There are quite a few, but the ones with the highest percentage of removal are Mohs, micrographic surgery, which we've had for decades. And that's a procedure where you come in, the spot is removed and tested while you wait. So it takes the least amount of normal skin. The newer option is called ig-srt, or image-guided superficial radiation therapy. And then the revolutionary thing about this is that we don't need to do anything invasive. So we use ultrasound, that's the image-guided part, ultrasound to look under the skin to see if the skin cancer is going away or not. And the radiation that occurs is about the level of dental x-rays, but it's treated multiple times over a month period of time. So you don't have any downtime, there's no discomfort, minimal scarring, minimal pain. So it's a nice option for people that have a busy lifestyle and don't want to have any disruption.
Larry, you have had several cancerous spots, cancerous moles treated with this treatment and have had great success. How many skin cancer lesions have you had treated?
7.
7. Did you used to work outside?
Yes.
We've got our patient inside the room, so you step out, and this is the machine that you deliver the radiation with.
Correct. So this is what we call the console, where everything is delivered from. So we can control everything from outside of the room here.
Having this option, this gentle option, that's pretty important for patients.
It's very important. A lot of patients, especially with skin cancers on their face, patients that have comorbidities with diabetes, they have their blood thinners. There's all these complications that come into play when surgery is the only option. And so this offers a more gentle option for them to not get cut on, minimal scarring. It's just an all-around really great option for them.
You've chosen this treatment that uses radiation, a small dose. And what has this been like for you?
Oh, it's super. I can go about my normal day without any problems. I don't have to have some places stitched. I've had the surgeries before, and this is, as I say, it's non-invasive, and it just makes life easy.
So I can see here you've got the radiation, the beam,
Correct.
physically on his skin cancer.
Yep, correct.
It's directly on it.
Yes.
And he just sits there for 15 minutes, 15 minutes?
This is about 30 seconds.
Oh,
Yeah.
well, what's the 15 minutes?
So the prep is what takes the longest.
It's shrinking that lesion from underneath the skin. Am I understanding that?
Yes. So basically what's happening is the radiation is disrupting the DNA within the cancer cells.
There's no downtime for this. You walk in, you treat the spot, 15, 20 minutes later, you're driving home.
Absolutely.
Radiation's been around for a long time, but the image-guided part has been more recent, and because of that advance, we feel a lot more comfortable about getting rid of these skin cancers without having to do a bigger procedure.
And success rate is high.
It's 95 plus as well.
What are your patients thinking about this?
They love it. They love it.
So this treatment is also known as GentleCure. Great name on that one. And multiple treatments are needed to successfully remove a skin cancer. To give you a better idea of what the cancer looks like on an ultrasound, though, this picture is an ultrasound before starting treatment. So the black hole is the skin cancer. That's the damaged skin tissue. And then this is an ultrasound from a patient's 8-week follow-up.
Well, dude, look at that.
So you can see there's now healthy tissue filling the spot where the cancer once was. So let's take one more look at the side-by-side of the before and the after, and they call it the GentleCure. I mean, that's pretty incredible when you think about like just even what that does to your body in terms of the repair that's needed if they're slicing and dicing, you know?
Look at all the other cells around it.
They're so happy.
Yeah, they're so happy. So all the other cells around, not just the black hole, but even look at the top picture, like all those cells, you know, to the left and right, they all seem pretty happy, and there's new growth there as well. So
really,
everybody
interesting.
wins.
I guess. Very good stuff, Kelly. I like that
cool
story.
Stuff.
That's interesting.
All right, if you've been diagnosed with a non-melanoma skin cancer and you've been told you need surgery, well, just call Advanced Dermatology Care to schedule an appointment to see if you're a candidate for the less invasive treatment. You're also going to find more information at TwinCitiesLive.com. We'll be right back.